Good afternoon, everyone. Thank you for joining us again. I'm Governor John Carney. This is our weekly press conference on Delaware's response to COVID-19. We have our team back this week. I'm joined by Dr. Karyl, Rattay, the Director of the Division of Public Health, and A.J. Schall, the Director of the Delaware Emergency Management Agency, our testing czar, if you will, who continues to do great work with his teams up and down our state in partnership with our colleagues in Newcastle County and pop-up sites in churches and community centers and schools across our state. We've had significant improvement there. We're testing more significantly now at the University of Delaware and the Newark community. We'll talk a little bit about that. And Dr. Rattay is going to talk a little bit about the approaching flu season. We were talking about it just earlier today. When you think about our initial really serious concern back in March and April when the COVID-19 pandemic first hit here in Delaware on March the 11th. Very concerned in the early days about the hospital capacity that we had available to meet the demand, the surge that we expected to see. That surge reached 337 hospitalizations at the end of April. I think April 27th was the peak, and with the return of the flu season this fall and winter, we normally get a surge similar to that, Dr. Rattay. You'll talk about that. And so obviously we're concerned about that, and with our hospital partners who've been really fantastic over the last 7 months and meeting the challenge in their institutions and in the community outreach to help us with testing in the early days and really carried that burden for some time. Looking forward to meeting that challenge as we move into the flu season. I'm going to get my flu shot, which is why I have my short sleeve polo on today. It is the Delaware Department of Agriculture polo, and so and we did hear some good news from our farmers with respect to the COVID-19 cases with migrant labor that came up the coast to help growers with the harvest, and we'll take a look at that in the days ahead as well. So we're going to talk a little bit about, I was on the White House call earlier this week, yesterday. Dr. Birx, who was one of the technical people working with the White House, focused on colleges and universities, visited 10 states to see how they're responding and pushing down the spread of the virus at those institutions. We've seen it at every major university and college across in almost every state in the country, and we're seeing a little bit of a surge here in Delaware, which is pushing our cases up about 10% over where we were a week or two ago, and a couple of weeks ago, and we'll talk about that a little bit. We're really working hard with University of Delaware and the city of Newark, Delaware State University, with respect to these challenges, and mostly centered, we think, in off-campus social activity, parties and the like that are beyond the allowances, certainly in the city of Newark, for a number of people gathering inside of a private home. So we've got to focus on that in order to push these cases down. Our overall objective remains the same: to get people and workers back on the job and children back in classrooms safely, working with school districts, administrators, teachers, and staff. Already they're challenged with the remote and hybrid learning arrangements that are underway in districts across our state. Been out visiting some of the schools and districts, and I will get out to see more. And they're just doing really amazing work. It is challenging with children at home, sometimes with parental guidance, sometimes in daycare centers, the school-age children, and everybody's really leaning in and working through that. Obviously, the best situation is when the children are in front of classrooms live. I had a conversation with the teachers about just that. They miss their children, and the children miss them, but we need to do it safely and in a way that protects the health of both students and staff, and we believe that we can do it. There are lots of challenges that need to be met, and everybody's really leaning in to try to do that. So why don't we take a look at the presentation for this week. We're over 20,000 total cases across our state, 635 Delawareans who've lost their life with COVID-19, everyone a precious life. We're up to 64 current hospitalizations. We've been up and down, above and below 60. I think we got as low as 40 about a month or so ago, and so we want to push that number down, particularly, as I said, as we look to the return of the flu season and the hospitalizations that come as part of that, which in any given year could be as many as we saw in the spring with respect to COVID-19 hospitalizations. And so that will be part of our conversation with our hospital partners in the weeks ahead, and just to make sure that we're prepared. And they did a great job back in the spring, as I've said, particularly with testing and then meeting those that had hospitalization needs. We didn't come close to our capacity, either in terms of hospital rooms nor in terms of the ventilator equipment that's necessary to really treat somebody with serious COVID-19 illness. So the cases, as they break down across our state, we've got 10,000 positive cases now in Newcastle County. In Kent County, we're at 2,900, almost 3,000, and then in Sussex County, again, still the highest rate per population at 6,700. A lot of that was due to the outbreak that we saw both in the poultry industry in Lower Delaware, as well as in the beach bars and restaurants, at the peak that we had there in mid-June and into July. So we're up to 7%, over 7% positive. This is higher than we want to be. 5% is the target, 3% positive for moving children back fully into classrooms, and so that's ultimately the goal. And we're up now over 100 on the 7-day moving average for new positive cases per day. Again, about 10% increase over where we were. We were bouncing around in the high 80s, low 90s, and above 97 several times, which put us on out-of-state quarantine list with New Jersey and New York, Washington, D.C. area. So we want that 109 number to be down below 90 and significantly below that over time. The ultimate goal for our educational gating criteria is 10 new cases per day. We're a long way away from that. Still, the young adult population is driving a lot of these, the uptick in these cases. Again, students are returning to university, mostly not any one particular party specifically that we've seen through the contact tracers or heard from our contact tracers, but just that kind of off-campus social activity, some cases associated with bars and restaurants there in Newark and other places. But we need to really double down on face mask wearing and social distancing. Here's the 14-day view with our data dashboard. Everything's pretty flat in terms of the new hospitalizations. The hospitalizations generally there now at 64, and the percent positives is bouncing around above 5%, where we prefer it not to be. And new positive cases, again, as I said, we are seeing some blips up and down. Some of those we think are attributed. We're still trying to understand all of that. There are some data entry inconsistencies, that's my term, that we need to iron out. So you really need to look there at the 7-day moving average. Some of those inconsistencies are the University of Delaware is doing some surveillance testing, meaning not just testing numbers of students and faculty, so they can come up with some feel for the extent of the virus in the community. We know that overall they've had about 300 cases over the last several weeks, which is pretty big number in the scheme of things, certainly much larger than what we had been seeing up until the return of students and folks to school. So we're going to see some ups and downs on a day-to-day basis. I guess, AJ, it's twice a week that they do the surveillance testing, and of course we get those results pretty quickly after that, both the positive cases. They say that the percent positives are fairly low, which should bring our percent positives down a little bit. We haven't seen that on our dashboard of yet. If you look at the 90-day view, really very flat, not a lot happening other than some of what we saw back in July in the beach communities, a little bit of uptick. We really started to make good progress as we went into early August, and then with the return of school and college, just a little bit of an uptick. Up until now, all of our PPE vessels have been fully filled up to the top. Now we have one, AJ, that's a little less than full. Could you explain what's going on there with the gloves?
No, so happy to. So the bad news here is the gloves are probably one of the hardest commodities to find right now from PPE. There's about 5 or 6 manufacturers and factories that make a majority of the medical grade gloves that it's used across the world. In the middle to late summer, they were shut down due to COVID as they had issues with their staff. So as they come back online, that was a little slower to kind of refill or keep stocked. Good news is our Steve Blessing's team over at Public Health has worked with Dean Stotler at GSS to identify, and we actually have we have PPE coming in across all the types that you see here, but we also know we should have some glove orders received in the next 10 to 14 days. So strong work by them to make sure they stay on top of it. The good news as well is, the dependency and the number of requests that are coming in is not what we saw in April, May, and June. So that's showing us that the medical community, the first responders and others are having a higher level of success filling their own orders. So it's, however, we still want to prepare for the fall or when we see these surges.
Yeah, and so this is really, in terms of what we have in the stockpile, this isn't to say that we don't have these gloves available.
Correct.
And these are gloves that are not generally used by the general public, but more by first responders, healthcare workers, and the like, of course, very critical users of the gloves. Okay, AJ, thanks for that. Again, just to remind folks and put in context, which is the reason that we track the data dashboard is, again, for purposes of guiding, providing the science and the guidance from CDC and from the White House Task Force about bringing, and our own Division of Public Health about bringing students back to school. We're currently in the yellow category, pretty firmly there, 6.5% positive. That's a little bit different number than you saw on the data dashboard. It's got a different time lag there for the calculation, but again, it's above the green category gate, which would be 3%, is where we want to be. New cases, again, 72 per day. Again, a different measure than what we see in our new positive cases per day, but that's significantly above where we want to be. And of course, the average daily hospitalizations is firmly in the green category. So our objective is to push that percent positive number down below 3% to bring more children back to school. So looking forward again, we have the dual objectives of bringing children back into classrooms and workers back to work. And in order to do that, in order to accomplish that, in order to get the health of the community where it needs to be, in order to make it safe to bring students in greater numbers back to the classrooms and more workers back to work, we need to push those numbers of new cases per day down. We need to push the percent positive down. We need to get more people tested. We are doing a little bit better job, AJ, of getting our testing numbers up. We were testing close to 15,000 per week, I think, at the peak, and then we went down with weather and some other issues down to around 12,000 or something like that. And now we're pushing it up again, aren't we?
Yeah, so we were August, if you took out the weeks that we did the testing specifically for teachers and faculty staff at schools, And then to help the schools that were going back in person, if you take those weeks out, we were averaging right around 10 to 11,000. Last week's preliminary numbers look closer to 14,000 between the curative sites, state service centers, Walgreens, and some other lab results that we have in. So definitely going in the right direction.
So also vaccine planning, a lot of discussion on our communications with the White House Task Force about the potential for vaccines. Obviously, we need to be prepared here in our state. Quite a bit of planning going on with the Division of Public Health around that challenge, sorting out what populations to target first. Obviously, the most vulnerable populations will be targeted, and that'll continue on for months. And then the return of colder weather does present a lot of challenges because we're moving a lot of activity from outdoors to indoors. You know, one of the real, if there is a lifeline for kind of restaurant establishments has been the ability to use some outdoor spaces and expand their table capacity by expanding into parking lots. And you know, Newark has allowed dining on Main Street, closed Main Street down. In Wilmington, Trolley Square has moved out onto Delaware Avenue, and it looks like lots of people are taking advantage of that. Just one of the ways that we've been able to help those businesses, frankly, that have been hurt really badly. So with the return of colder weather, that's going to push people back indoors. It's going to eliminate some of those opportunities for restaurants to do business outside, and so we need to, again, push those infection rates down so that we can reopen those businesses a little bit more indoors to enable them to be successful. We've had the first round of small business relief and support. We've got up to, those grants are available up to $100,000, and we've been pushing out, we will be pushing out the numbers soon for round one, and then the round two applications are available by October the 1st and beyond. So some of that money, just to give you an idea of round one, about over 1,600 applicants eligible for $54 million in grants. So we had $100 million in relief grant money available for mostly small businesses, and 1,600 applicants for $54 million, roughly half of that those available resources in round one. More than half of the applicants were minority or women-owned businesses, so we're getting, broader reach than maybe in the earlier PPP program from the federal government. 2/3 of the dollar amounts accounted for are in what we call disproportionately impacted industries. I've said all along that some businesses have sacrificed more than others. These are food services, retail, personal care, those kinds of things that involve very close personal contact with folks, and establishments that bring people together to dine, in hospitality, food service, the like. 75% of the business and nonprofits that applied had annual revenues under $1 million, and almost half under $250,000. So these are really your mom and pop small businesses, and some a little bigger than that. 75% of the applicants have fewer than 10 employees, more than half fewer than 5. So really the small businesses across our state. You hear a lot of people questioning where the COVID relief and CARES Act money and funding that we receive from the federal government, where it's been applied to. You can see in this pie chart here that the vast majority of those resources will go to unemployment, an unemployment insurance trust fund, about $350 million out of the $900+ million that we received. Child care assistance, in order to keep our child care centers open. Last spring and through the summer and up till this point has been over $100 million, $128 million to be exact, as we think about also those centers as we move into the fall, and providing backup support for school-aged children who are not in school. We visited some of the child care centers that do that. A lot of resources going out to keep those facilities up and running successfully. The relief grants that we just talked about for small businesses of $100 million, and then, of course, our various testing programs close to $100 million at $80 million and counting, I think it's fair to say, AJ, and then a whole series of other expenditures, mostly around public health work, small business loan support, rapid workforce retraining for employees, our community provider relief fund for nonprofits, broadband infrastructure for children and low-income families that don't have the equipment to do remote learning, and other state agency-related pandemic expenditures. So these are significant commitments. We again thank our congressional delegation, Senator Carper, Senator Coons, and Congresswoman Blunt Rochester for their support of the CARES Act and the next relief package, which is still being worked on. We're hopeful that they're able to push something over the goal line, although it looks a little uncertain at the moment. Lastly, I'd just like to remind people about our iPhone app, COVID Alert DE. Protect yourself, slow the spread. This is a way of participating anonymously into an app on your phone that would alert you if you've come in contact with somebody who voluntarily acknowledges that they tested positive through contact tracing, and alert will be sent to your phone so that you can know that you should either quarantine or certainly get tested. And really, we think a really important tool. I think we're up to 90,000 folks that have volunteered to sign on to it. Obviously, we'd like to get thousands more. The more we get, the more effective it will be. I understand the uptake at the University of Delaware has been going reasonably well, although it's hard to know that because we don't know who folks are with respect to this, but really an important tool. So with that, just as some introductory comments and walking through our normal data dashboard, AJ?
Thank you, sir. Go over a few testing updates this week. Some are continue kind of with the initiatives we started over the last few weeks. First, the at-home test option that I guess is a little bit over 2 weeks old right now. We've sent out 4,500 URLs for registration for people. This is a great, convenient, and easy way to make sure you could get tested. If you're planning vacation, if you're going to see family, if you've gone to an event, if you just want to get tested once a month, this is an avenue that you could do and kind of almost know it's something you do every few weeks and do it on your schedule. Two things that are required for this: an email address and then a smartphone or a tablet so you can do the Zoom session with the medical professionals. Again, we have capacity here. We want to make sure we add this to our kind of testing foundation and make sure people have access to testing on their schedule. Next, we didn't include anything about the static sites this week, but just some numbers from last week. Between the state service centers and the clinics, they're just under 3,000 tests there, and that does not include the Walgreens. So they're kind of those Monday through Friday, some of them open Saturday, Sunday, areas that people go get tested, and we're still doing the pop-up sites. So Newcastle County this week, we actually have 6 sites. One didn't make this flyer, which because it's actually Saturday, but yesterday was Middletown. This evening, actually starting probably a few minutes ago, is Frawley Stadium in Wilmington. Tomorrow is Eastside Charter. Thursday's Judy Johnson Park, October 1st already, and then Friday in Newcastle at Seeds of Greatness Church, and then Saturday morning at Aspira Academy on Ruth R. Drive in Newark. So all these can be signed up at the delaware.gov/get-tested and the Curative website. Kent and Sussex doing Smyrna Middle School today, and then tomorrow they're getting ready to go back into their hybrid environment. That is also open to the public. And then we'll be down in Sussex County at the Georgetown Del Tech site on Thursday, October 1st. All those are registered the same way at the DelawareCurativeInc.com. Brings us into our next point, which is school testing. So a lot of the schools delayed their hybrid model to early October, anywhere from early to late October, depending on the school district. So we are working with Newcastle County as well as 13 school districts to do on-site testing, not at every school, but for just about each district over the course of the next 4 to 5 weeks. So we want to make sure students have the ability to get tested at a place they're comfortable prior to going back to school to get a great foundation and baseline. We're also working with some vendors to find how we could, efficiently do surveillance testing there with students on a repetitive and almost automatic type, frequency. So excited about that and to get the students back and assist the districts however we can. So we've had a great partnership with Curative since May. I think a lot of people have seen the ease of the test, how quick we get the responses back. They continue to be a good partner and kind of bring new automation, new initiatives, and new products that we could use. So this week, either today or tomorrow, and we'll have information on it, they are changing the look of the registration page. So they're going to have a map view where you'll see a few areas when you zoom in on it, and you'll see like today and tomorrow or next week what dates they have, the appointments available. Click on it, then you make a registration the same way. It's just a different way for them visually to lay it out. So do not be surprised when you see that. That is Curative's new site, and hopefully it'll be a more visually, experience to help you make those reservations. Also on the Curative standpoint is we're partnering with them to bring a trailer that's going to be in Delaware probably by the middle of next week. That's going to be able to do registration appointments, and we'll be able to run that into a neighborhood or a community or location, do a 5 to 6 hour event. People walk up, scan their barcode, they'll be pre-registered, do the swab themselves, give it to the representative, and it gets shipped off to the lab. So it's just going to be one more tool that we have that's flexible, that's quick for us to hook that trailer up, go somewhere, you have all the equipment and the staff needed to run it, and we will expand that program as we kind of identify where it needs to be and where it makes sense to go. So you will see that probably early to mid next week, and we're excited that we've partnered with them to even bring one more layer, one more option to the residents of Delaware, sir. And that is it for testing.
Yeah, so lots of changes, lots of improvements in testing over the last 7 months. We started out most of the testing being done on symptomatic patients that were referred by physician offices to the hospitals and done at the hospitals. We ramped up our testing that was coordinated by you, AJ, with your partners, including Newcastle County with the Curative sites all over the state, and tested thousands. We had pop-up sites working with community partners, places like you mentioned the pop-up sites for this week, Seeds of Greatness Church in Newcastle, Eastside Charter School in the northeast section of Wilmington, Frawley Stadium, Judy Johnson Park, all of these bringing tests to the people, and have been doing that for months, and will continue to do that to make sure that we're testing in every community in our state. Those testing numbers continue to, and we need participants. We're falling off a little bit, so we need to get the word out in all these communities. All our partners, we're really challenging them to get the people to the testing sites, and we're seeing other technologies, the test-at-home technology, which we've used, as you said, for school personnel, and there's going to be more of that. So we'll not only, we won't have to take the testing site to a parking lot near you or a school near you. We'll take the test to you, and you can download it, and it'll be easier all the way around. And we're going to continue, I think, to see innovations and improvements in testing, which will help us all the way around. The trailer, another good example of our partnership with Curative, and giving us another tool in our toolbox to make sure we're getting into every community in our state, and making sure that every population in our state, whether they have access to a car, or whether they have to walk to a site, or whether they can access the site more easily, will get access to that testing. A really important part of our response to COVID-19, and will continue to be as we try to manage this into the fall and winter. Dr. Rattay?
Great, thank you, Governor. So first I want to just touch on the areas in Delaware that we've been keeping a close eye on. Wilmington is one of those areas that we've been talking about for a while, several zip codes that have been fairly consistent, 19802, 19805, that have been slightly elevated. So when you look on My Healthy Community, you'll see for Wilmington and those specific zip codes that percent positive as well as cases are slightly elevated in comparison to Delaware overall. Newcastle for today has 17 cases. So that's an area we've been keeping an eye on, 19720. We had testing at Seeds of Greatness Church a couple days ago, so this is a reflection of the great testing that's been going on there. And Newark is the area, as Governor Carney was mentioning, that we really have continuously been keeping a very close eye on with partners, with the UD, with the city of Newark, to keep a handle on what's going on with the students in the Newark area. So 29 cases today. Most of those cases are young adult cases, and in either the city of Newark or 19711 zip code area. So again, continue to work with the university and the city on testing as well as enforcement and education approaches to try to keep a handle on that situation. Let me shift gears a little bit and talk about long-term care. We did put out a release on Friday to share findings of outbreaks in 3 separate facilities, including the Kentmere Rehabilitation and Healthcare Center in Wilmington, Cadia Healthcare in Silverside, and the Country West Rest Home in Greenwood. In all 3 of these facilities, we're seeing cases among residents and staff. Now, the source of these outbreaks is under investigation, but what we can say is that indoor visitation is not a factor in that none of these facilities had begun indoor visitation. Additionally, lack of PPE is not a factor, as the governor and AJ were previously talking about. Facilities have had adequate PPE. In fact, we've had little to no requests for PPE for our team in quite some time. So that is not a factor in these outbreaks. But certainly we're working closely with these facilities and across the board with long-term care to ensure that we've got the best infection control measures in place. So DPH, along with our sister agency, the Division of Healthcare Quality, or DHCQ, are working to do infection control surveys in these facilities. And what that really does include is making sure that they're top-notch with infection control, prevention measures, PPE usage, getting people in quarantine that should be in quarantine, getting people in isolation that should be in isolation, and just making sure that they're really doing everything that they can to prevent future spread of infection. We also have a team of epidemiologists who are working on investigation of these facilities. Active daily screening remains in place, which means every staff member gets screened at the beginning of their staff. Every resident gets screened for fever and symptoms on a daily basis. Additionally, you may recall that in the spring we required training for all staff. We have updated that training on infection control and are promoting that staff repeat that training just to make sure that everybody's on top of their game. Additionally, there's new staff in a lot of these facilities, so again, we just got to make sure as we enter into the flu season that everybody is really knows how best to prevent infection. One thing that we did last week is we went back to the requirement for weekly testing for all staff. A number of facilities had been able to go to bi-weekly testing, which means they hadn't had any positive cases in at least 14 days. But seeing these outbreaks, we decided pretty quickly that we really needed to go back to weekly testing for all staff. So that has taken place. Additionally, we've had all along regular calls with long-term care facilities, but again, it's really important that we continue those calls and make sure as many long-term care facilities and their teams are on these calls to, again, make sure that we're all lined up as far as how best to prevent infections. So these are some of the many things that we're doing with long-term care facilities to get this under control and very importantly, prevent future outbreaks. So let me shift gears again and let's talk about influenza. Flu season has officially started in Delaware, and we have launched our enhanced communication and awareness campaign called Fight Flu Delaware. And this campaign is focused heavily on grassroots efforts and communication strategies to reach Delawareans where they live, and really to highlight two things. One is, with COVID-19 still with us, it's more important than ever to get your flu vaccine this year. And secondly, our campaign focuses on where you can get the flu vaccine. We know that flu is a highly contagious infection. Last year, we had more than 7,000 Delawareans who got the flu. Nearly 400 were hospitalized, and 11 died. As the governor mentioned, every year when we get to the peak of our influenza season, our healthcare systems are maxed out. They are full. And so with COVID with us this year, it's incredibly important that we all do absolutely everything we can to prevent a bad flu season for us. In fact, we are really, really hoping and praying that we have a very, very, very mild influenza season, and not only because we need to protect our healthcare system, but the reality is if you get either one of these infections, you may have an increased susceptibility to get the other. And so this double whammy could be very problematic for individuals who get either or both infections. So we know that the vaccine itself, the flu vaccine, isn't going to prevent you from getting COVID, but it will lower your risk for illness. It lowers your risk for more severe illness, for needing to go to the doctor. It decreases risk of hospitalization by as much as 40%, and also significantly decreases death from influenza. So again, very important to get your flu shot for everyone over the age of 6 months, but especially those who are in high risk categories. So those between 6 months and 2, so under 2, as well as women who are pregnant, people who are over age 65, individuals with chronic conditions. It's the same chronic conditions that put people at risk for COVID. So it's diabetes and cardiovascular disease and obesity and the people with immunosuppression. Those are the folks that we are the most concerned about. Please make sure you get your flu vaccine, especially if you're in one of those categories. And so one thing I really, really want to highlight is our gratitude. Governor already mentioned how grateful we are to our partnership with our healthcare, our hospitals in the state. But with this flu season, we've all come together, the Healthcare Association, the Medical Society, our federally qualified health centers, other community groups and faith-based partners to really get the word out there around the importance of the flu shot this year, as well as where you can get it. And we call this the big 4 locations of where to get your flu vaccine. So, of course, you can schedule an appointment with your medical provider, which could be your primary care office or your federally qualified health center. We've got great ones in Delaware: Westside, Henrietta, Johnson, and La Red. All are places where you can get your flu shot, either at your annual physical, which I want to remind people, make sure you get your annual physical, as well as even sick visits, you can get your flu shot. Pharmacies across the state, whether those who are independent or in grocery stores, offer flu vaccine almost always for no out-of-pocket cost for people. So that's a really great, convenient option. But also, we have community flu clinics, and we have DPH clinics by appointment only throughout the flu season, especially for those who are uninsured and underinsured. This week, in fact, we have 8 clinics statewide. So go to flu.delaware.gov to find out the locations where you can get your flu shot. And again, we are really strongly recommending that people get their flu vaccine before the end of October. It takes a good 2 weeks for you to become protected after you get the flu shot. So the earlier you can get it, the better. Finally, I just want to take one moment to really distinguish between flu or COVID. As we saw in the springtime, it's kind of confusing when you start to get symptoms. You know, do you have flu or do you have COVID-19? Because many of these symptoms, fever and cough, shortness of breath, fatigue, sore throat, runny nose, muscle pain and body aches and headache, are very similar for both of these illnesses. But there are some differences. Of course, with COVID-19, there are many people who don't get any symptoms at all. Also, with COVID-19, it has this unique symptoms of loss or change in taste and smell. We don't see that with influenza. For influenza, in general, you typically see a very sudden onset of high fever and just feeling miserable very quickly. So that often is a sure sign for influenza. But either way, if you begin to have these symptoms, of course, you want to make sure that you, first of all, isolate yourself, talk to your healthcare provider about what you need to do. Certainly, keep that face covering on and get tested for COVID. Many places are testing for COVID and influenza simultaneously. And so with that,
Let's fight the flu. Dr. Rattay, part of my job as governor is to model appropriate good behavior in public health preventive actions. And today I'm going to do that and take one for the team and get my flu shot up here on the stage. That's why I have my short sleeve shirt on. I'm going to put my mask on, and Dr. Rattay is going to prepare the needle. And we're really encouraging all Delawareans to do this, to take the precaution. If you just think about the math for a minute and our focus on protecting that hospital capacity, if we have a normal flu season, as Dr. Rattay mentioned, we can have hospitalizations in the 400 to 500 person range. If you remember earlier in the presentation, we talked about the high point of hospitalizations for COVID-19 at 337. Today we're at 64. So 64, and you add 350, you're quickly at well over 400, AJ, and we're in the red zone there. So this is an area of considerable concern. So make sure you get your flu shot. And I'm going to get mine right now, right up here on stage with my Department of Agriculture polo shirt on. Last year it was the drive-through at the Department of Transportation stand-up site. And I think for everybody,
sorry, Governor. That didn't really hurt, right?
oh, I'm just, I just need to be a little bit. No, it did not hurt. They don't hurt. The flu shots don't hurt, and they protect you and from getting the flu, a serious case of the flu that could put you in the hospital, which is what we want to avoid. And so that's why we're leaning into our Fight the Flu program. Get your vaccine today at flu.delaware.gov. Get tested for COVID-19 today or this week. We have a state testing site coming to a parking lot, a school or a church near you, and soon. You'll be able to get a test at home, and we're very excited about that. So with that, I'd open up to any questions. I see Meredith here from Delaware Online, the News Journal, and I think we had just a handful of pre-submitted questions as well.
Hello.
Hi, Meredith. Thanks for being with us.
Governor, I wanted to ask about the DSU event or incident that occurred this weekend. From my understanding, this is the second high-profile event where hundreds of people have come together, not following your executive order. I think a lot of people are confused why the state might not know about this event before it happens, considering the fact that so many people were together in one space. Can you speak to that? Why the
Yeah,
state
first
might
of all,
not have known?
it's horrible, and it's heartbreaking for the family and the folks at Delaware State that are involved. We're still at a very high level getting the facts, but we have been in communication with Delaware State, with the University of Delaware about these off-campus gatherings. What I know about the gathering is that it was not a legal gathering. It was beyond the number of people that are permitted under the state of emergency with respect to COVID. I mean, first, I think it needs to be said how horrific this must be for a parent, for a family to have to deal with a situation like that. It does say something about the culture of guns and settling disputes by shooting folks. We have this issue at a different level, I think, in other communities in our state, in Wilmington and some of the smaller towns across Delaware. And we really feel like we've got to get into the groups and gangs in some instances, whether this was related that way. Delaware State, I don't know. But what I do know is that we have an epidemic of shootings in our state, and we need to really figure out better ways to stop it and push it down. With respect to the gatherings itself, we should know. Obviously, it wasn't a permitted gathering, and so you're probably not going to know beforehand, but local authorities and others should know once the gathering occurs. People make complaints all the time. And in a previous gathering like this, party, if you will, the organizers, we understand, were expelled from school, one thrown off one of the sports teams. I think appropriate action given the severity of the violation. And these young people need to understand that these gatherings, these activities are dangerous, not just with respect to a violent act like that, but also just normal behavior that doesn't turn up with a violent act. And so we've got to lean into that with our partners in local government and our universities.
Does it make you consider making restrictions even more severe, considering that this has happened?
It makes me think about what we need to do on the enforcement side. And by the way, I pushed back pretty hard when we heard some of the disciplinary action that was being proposed, that we didn't think it was strong enough. And those were changed at University of Delaware. And Delaware State took, I thought, appropriate action on the first incident. Again, we're learning more about this. I'm just heartbroken by the thought of it, and obviously we're just going to have to redouble our efforts.
And with you mentioning the gun violence that occurred, Delaware is experiencing one of its deadliest years for gun violence. What do you think needs to be done at the state level to curb?
Yeah, we believe we have a very evidence-based approach. We call it GVI, Group Violence Intervention. Most of the shootings in the city of Wilmington are perpetrated by young males who are involved in gangs or groups. It's one shoots another, it's retaliation, it's back and forth. It's maybe 300 people total, 200 and some to 300. We know who they are, and we've identified these perpetrators, and we've given them an ultimatum, basically. Either you continue to do that, and then we're going to come down with the full force of the law on you, or we'll help you find a way out. It's worked in other places, in Boston, High Point, North Carolina. It comes out of the John Jay School in New York. COVID-19 has put a stop to part of it because it involves pretty intense interaction, personal interaction between our social workers, interveners, probation and parole officers. It's just a whole new approach that we've started both for offenders that are being released from prison. They've been incarcerated for one reason or another, as well as individuals who haven't been incarcerated but who we know are involved in these groups. And so it was also tried successfully in the city of Boston. So COVID-19 has turned it upside down a little bit, but we're going to continue to lean into it and put resources to it. And what that involves is the state Department of Corrections, the State Department of Health and Social Services, working hand in glove with Wilmington PD. We're piloting it in Wilmington, where most of the shootings are, and working in conjunction with the Attorney General's office and the U.S. Attorney's office with respect to the penalty side of things, the threat of that.
Just turning to schools, the Red Clay School District sent out a waiver to parents who want their children to be physically in the schools, asking them to absolve them of any liability issues regarding COVID. I'm curious if you could comment on this idea of schools sending out these waivers to parents, and if this is something you think other schools should do, just considering.
Yeah, I'm not a lawyer. It's not come up in the discussions that we've had. I know that there's concern about it. There's concern among our hospital partners about being sued for the activities under COVID-19. I understand that. We've been trying to work through that unsuccessfully so far, I might add. And so it's understandable to hear that as well. I know there's a large percentage in Red Clay of parents who want their children in school. The challenge that they have, I know, in Red Clay is that their facilities don't allow enough, or they're having trouble getting the facilities enough space in classrooms to spread the children out enough to accommodate all those who want to be there. So most of the districts who are doing a hybrid model, some remote learning and some in person, are able to do that because some percentage of their parents say, I'd like my child to be fully remote. And that's mostly 60-40, so 60% who want in-person instruction, 40% who want remote. That enables them to configure a classroom that's safe, right? So it does raise the question, well, what do we do when we get, into a full green scenario and we've got to bring all the children back? That's something that we'll have to struggle with as we get to that point. I hope and pray for that a day coming sooner rather than later. We're not there yet.
And just to clarify, there's no movement on terms of hospitals and nursing homes?
No, not at the moment, no.
And just for Dr. Rattay, has there been confirmed cases of the flu so far this season, or?
No confirmed cases, but this is the time of year when we start week 1 for flu season, so we start tracking it.
Got it. Thanks.
Thank you, Meredith.
All right, we just have 2 questions today. The first one is from Betsy Price at Delaware Live. Does the governor have any response to the Court of Chancery ruling in Delaware Republican Party's lawsuit trying to stop mail-in voting?
Yeah, I think it was the right decision, obviously. I think it's just common sense. The effort, the legislation that was passed by the General Assembly to permit vote by mail was done so in the context of a unprecedented COVID-19 pandemic. And it was passed with the intention of protecting public health and enabling all Delawareans to exercise their constitutional right to vote. So it's a really important constitutional right, the most fundamental piece of our democracy. And so the idea that somehow we would make it harder for people to vote is just beyond my comprehension. We ought to be making it easier to vote and to vote safely and securely, and that's what the vote by mail enables. If you look at the example of the primary, tens of thousands of voters voted by mail. They were able to do so. They did it safely. They didn't have to go particularly, and was widely used mechanism by our most vulnerable population. So the idea that somehow we would put our most vulnerable populations at risk just is incomprehensible to me. We ought to be finding ways to make it easier to people to vote and to vote safely. And fortunately, the judge saw it that way. I read or heard part of the transcript, and he was kind of incredulous about the idea that somehow he would invalidate, thousands of legitimately cast ballots for some obscure concern. And that so fortunately, he made I think the right decision, and we'll be able to have vote by mail. It will require that the votes be in hand with the Department of Elections by the time the closing of the polls on Election Day, so 8 o'clock on Election Day. And so anybody, I know a lot of people have already requested vote by mail ballots and have received them and are voting. But for those of you who might think about holding it on towards the end, then you need to make sure that you get it in the mail by that Thursday or Friday prior to the Election Day to make sure it's received in hand at the Department of Elections. If you're not able to do that, you forget about it, you're not around, whatever the case may be, there are drop boxes in each county where you can submit your ballot on Election Day.
And the last question is also from Betsy Price at Delaware Live. In light of the University of Delaware's financial problems blamed on COVID-19, will the state give them any kind of additional appropriations? Does UD qualify for any of the CARES Act grants?
Yeah, so they did qualify for CARES Act grant money. I don't know the exact number, but it was not insignificant. It was not nearly the loss that they had, but it was, I want to say, in the tens of millions of dollars. I'm not sure exactly what the number was. Hopefully there would be additional resources if the federal government has another COVID-19 Relief Act. I know that the decisions that they had to make were difficult ones. They have a significant revenue hit, as you might imagine, not getting revenue for students staying in dorm rooms for food service and the like, and pretty big numbers, and so they significant actions that they had to take, including tapping into the endowment fund. We have not had a conversation about resources that the state has received. We outlined briefly in the presentation today the big buckets there: unemployment insurance trust fund, testing, the Small Business Relief Act, a whole series of things. Obviously, the assistance for the daycare, $128 million, so some pretty big buckets along the way. But we'll continue to help to the extent that we can. All the institutions, businesses, and agencies in our state, nonprofit agencies, small businesses, large businesses, the university and colleges, and of course, our state agencies. So that's the last question. So again, thank you to everybody who's joined us today. Remember about downloading the COVID Alert app. I think I said earlier maybe 90,000. Maybe that was the hope, the wish being the father of the thought. We're more like 30,000 that have downloaded. I'm getting head shakes around the room that I misspoke earlier. I just want it to be 90,000, I think is what it is. That would get us close to 10% of Delawareans. Again, avail yourselves of the testing sites, particularly the pop-up testing sites in Middletown, Frawley Stadium, Eastside Charter, Judy Johnson Park, Seeds of Greatness Church, Aspira Academy, the curative sites. Keep your eyes on our website, de.gov/gettested. AJ's team are on the road, and we need to get as many people tested as possible on a regular basis. Your test, of course, is only as good as the moment that it was done. It's important that we know your status on that moment, but it's only good for that moment, so think about doing it on a semi-regular basis. We will lean into that with respect to teaching teachers and staff in our schools. our partnership with the University of Delaware. They're doing a lot of their surveillance testing themselves, as well as the at-home testing that's coming, and our curative vehicle trailer that we will be taking around our state. So thank you again for joining. Make sure you get tested and get your flu shot. Thank you very much.